Hi friends, Dr. Nancy Trimbley here, putting the power and knowledge of your health back in your hands. Please subscribe, click the button below. Subscribing is free and you'll get a notification of any new videos that we post. Today is about simple stretches for severe lower back pain. So if I have diagnosed you with a disc problem, whether it's a herniated disc, a slipped disc, an inflamed disc, these are the stretches that you can do, and you will be able to do these versus other stretches that are more advanced. You can do these stretches on the floor. You can also do these stretches still in bed, laying in bed. And one of the other things you can do in addition to these stretches, if you want to relax, I'm just going to grab this chair. If you want to relax your back, what you can do is put your lower legs onto either a couch or an ottoman. This bend relaxes your back. It actually presses your back to the ground, which will relax the muscles and give just a very slight decompressive stretch to your lower back. So you can do that. You can rest there as long as you want. The only trouble is getting on and off the floor. So if you can't get on and off the floor, I totally understand. You can lay on your bed and then put two cushions or big pillows underneath your lower legs to get that 90-degree bend in your legs. So these are the stretches. You're going to do these on your back, and again, you can do these laying on the floor or laying in bed. And you first are going to bend your knees so your feet are flat. You'll take one knee and bring it to your chest. This is easy to do unless you have knee problems, and then you can grasp behind your thigh. You're going to press and hold your knee into your chest, hold it for 30 seconds, breathe deeply, and you should feel a stretch in your lower back. This will be easy to do if you have a disc problem. After you do that one, you grab the other one. Again, 30 seconds, it's just a stretch, so breathe deeply and relax. When you're done with that, both knees together, bring them into your chest, really squeeze them in, and you'll get even more of a stretch in your lower back. When you're done with that, the next thing you can do is you can try the pelvic tilt, which means you're going to tilt your pelvis, and so you're pulling your pubic bone towards your rib cage. You're pressing your navel to the bed or to the ground, and this will create a pull or a stretch in your lower back. It's also a mini abdominal exercise. You hold that for a few seconds and relax it. So you should feel the small of your back flatten to the ground. If you're having trouble, you can take your hands and put them under your butt, and that will kind of create that same flexion of your spine. So you can, if you're having trouble moving your pelvis that way, just put your hands under your butt and try it again. So again, relax. You can do these stretches as often as you want. These stretches are designed to put a little bit of traction in your lower back. As a side note, there is a type of exercise called the McKenzie method where there's hyperextension of the lower back, where you're really leaning backwards. I don't recommend that for my patients unless I specifically tell you to do it. So if somebody tells you to do that, just say, hey, my chiropractor said I should stick to these other exercises. And because what we're doing with you is decompressing the disc of your lower back, and that is needed most often, 99.999% of the time, with your back in what's called flexion. And that's what these exercises do. So if you have any questions, of course, ask me. As always, putting the power and knowledge of your health back in your hands. Bye for now.